Good morning, everybody, and thank you again for joining this week's update blog in terms of events and festivals. And as we've done each week, we're going to look at the public health risk indicators that we in Warwickshire have developed to assess event and festivals over the coming weeks. I've put again back on the slide so everyone can see those indicators that we're looking at in terms of local incident rates within particular high prevalence groups, our hospital capacity, where we are in terms of vaccinations, and any information we've got on emerging variants. Delighted again, as always, to be joined by Gemma from Public Health. Good morning, Gemma.
Morning.
And I'm going to hand straight over to you so you can give us update information.
Okay, thanks, Jonathan. Right, okay, so I'll just kick us off and share my screen and have a look through the numbers of our COVID cases across the county. So this is our rolling rates per 100,000 population, and this just shows our different district and boroughs in different colours and their rolling rates per 100,000 population of positive COVID cases. So as we go along to the furthest right, which is the most recent data, this data was actually collected on the 7th, so we're a few days behind, but that's quite normal. But looking back over the last few weeks, you can see Rugby in particular, Nuneaton and Bedworth had sort of little peaks and then have fallen down. The numbers have fallen back down again. That's quite indicative of sort of small, perhaps workplace or school related outbreaks that we are expecting to see at the moment in the unvaccinated population. So that's just showing that. So if I come over to the far right, you can see that the Warwickshire average is 22 per 100,000 population, so that's well under the 50 per 100,000 population of our target. And then everyone else is doing quite nicely at the moment. Nuneaton and Bedworth and Rugby have come down from where they were, and they're sort of sitting at 34 and 30 per 100,000. And then we've got the lowest in the county of Stratford and Warwick, around just over 12 per 100,000 population. So looking really good. And then over to the other graph. So we do like to just touch on the cases age 60 plus. And again, coming over here, I mean, there was a very small increase there, but these, because the numbers of positive cases are so low here in this age group, they're single figures, any kind of small increase will show a little bit of a peak there, but we're really still in single figures for the 60 plus positives and not looking to be increasing. The final bit I'll just talk through as well is the vaccinations. So doing quite well across the county. We've now got, I think it's 37% here with 2 doses, so that's going up really well. And then we're just kind of really good coverage, and it's all increasing. The only ones that are a bit stuck are the 50 to 59s. They're quite stuck on 89% with the first dose. We'd really like to push them over the 90%, but I think we'll be doing some comms and perhaps some work around that. So I will stop sharing my screen. There we go.
Thanks, Gemma. That's really helpful. Again, in terms of hospital admissions and pressures on our NHS colleagues, at the moment we're not seeing any major issues from that side at this moment in time, which is really, really good news. So even where we are seeing small infections or outbreaks in certain areas, that's not necessarily translating to hospital admissions, which is a really good thing for everyone to know. In terms of new variants, I'm sure people are well aware there's been lots of coverage recently about the Indian variant and how that's impacting in certain parts of the country. We do have links to Indian variants in parts of our county. This moment in time, it's not something we wouldn't expect. When new variants come in, they do have the potential of spreading relatively quickly. So it's something we're very much keeping an eye on at this moment in time. We've not got anything as yet to indicate that variant is causing an impact in terms of hospital admissions. Again, we're definitely not seeing it in terms of causing any issues with regards to the vaccine. So that's something we're monitoring. We're waiting to get the SAGE advice from that side. but at this moment in time, I don't think, Gemma, is that we're particularly saying there's alarm bells in terms of that at the moment. So is that right?
Yeah, I think it's just, we've had a sort of small increase in Nuneaton Borough associated with the Indian variant, and it's just, I think it's safe to say, it's worth the active monitoring and just constant kind of testing that we're doing at the moment, just to keep an eye on the situation. But as you say, there's no evidence to suggest that the vaccines won't have an impact, and there's nothing at the moment to suggest that serious illness and hospital admissions have been affected. But obviously we constantly review, and it's just a really, really good opportunity to remind everyone to be vigilant.
And I think one of the things that we are talking with many of our event and festival organisers at this moment in time is how they can use lateral flow testing within their events and festivals, and certainly something we'd be hugely encouraging, not just for staff or those people who are running parts of your event for you, but also for those attending as well. A number of those organisers in the county have already put into place plans to have lateral flow testing for people who are attending their events. And that's definitely something we would be saying is very, very good practice, and also gives some confidence and reassurance to everybody who is attending your festival that it's a safe place to come. So that's definitely something to bear in mind. If you want any help on that, please feel free to contact us. And I'm sure Gemma Public Health colleagues and our prevent and response team will be more than happy to guide you in how to go about that. So we hope that's helpful. Gemma, thank you again for your input today. In summary, if you are looking to organise an event and festival over the coming weeks, none of the indicators would prevent that from taking place. Keeping a close eye on the variant, the Indian variant, to see if that's having an impact over the coming weeks. We're not flagging that as a major concern at this moment in time, but we would encourage you to bring in lateral flow testing, which again would bring that confidence to people who are attending and being part of your festival and event. So thank you to everybody again for joining us. Thank you again to Gemma, and we'll catch up with you all next week. Take care, everybody.
Thanks, Jonathan.